Hi, Calvin Vini, Insurance Coordinator, Duke Student Health.
I'm Ellen Crawford. I'm the Immunization Coordinator at Student Health.
I'm Danielle Oakley. I'm Director of Counseling and Psychological Services.
Student health insurance, or the Duke SMIP, basically covers minor and major medical procedures and certain types of labs, vaccines, x-rays, um, as well as cold, flu, sinus, minor aches and pains, cuts and bruises, that type of situation. So if you have any kind of minor illnesses or minor related issues, you can come in and do student health. We don't bill your insurance because it's part of your health fee. Or if you're an online or distance learner, if you go to your PCP or primary care physician or urgent care, they can service your needs there. And that's some of the things that the insurance actually covers. Oh, I'm sorry. What does student health insurance cover at Duke? Hey, no Facebooking over there. Does the school require an x-ray if a student has forms that show treatment for latent TB in the past?
So if you have a diagnosis of latent TB and you have actual documentation of the medication that you have taken and it's signed by a provider, you do not have to provide a new chest x-ray. If you don't have the documentation for the actual treatment that you received, we require a chest x-ray that's done in the United States in the last year.
Can I know the exact cost of certain medical treatments? Normally, the way it works is before you actually get a specific procedure done, you can always speak to a financial care counselor if you're in the hospital setting or at urgent care. They do have financial care counselors that can go over your benefits for you. If you're inside of the student health or student wellness building, it just depends on what services are being done. Once again, if you have a paid health fee, if you're a student that's going to be on campus, your health fee basically will cover your minor injury or illness related things where you don't have to have your insurance run. The only time we run insurance is if it's for labs, vaccines or travel vaccines or actual x-rays. So if you're getting a specific type of procedure, like if you have to go to see dermatology, GI, rheumatology, or any kind of Duke specialties, then they have their own financial care counselors who can actually go over the treatment plans and the budgets and the cost of how much it will cost. We don't get that information unless there's a procedure code in the system, and then we can generate an estimate off of that. But without a procedure code in the system, there's no way for us to be able to determine how much it's going to cost minus professional fees. There's a difference between the health fee and the student insurance. The health fee is a fee that's paid that allows you to have access to Duke Well, Duke Reach, student health, and the nutritionists that are on staff. The health fee, like I said, of course, allows you to be seen in the student wellness building at Duke Well, Duke Reach, with the nutritionist without any charge to the insurance policy. The insurance policy is more geared towards major medical situations or, like I said, the lab work, vaccines or travel vaccines or x-rays. Anything else, like if you roll your ankle and you just need some ACE bandage or any kind of brace, that's all covered under your health fee. Crutches are covered under your health fee. To ask the doctor questions, to get it examined, physical, tested for strep throat, cold, flu, sinus, all that stuff is covered under the health fee. Like your insurance is more geared towards a significant injury or significant illness something that's considered to be major or could be major down the line.
The same would hold true for counseling services. Counseling and psychological services offers short-term care, so some type of an issue that may be resolved within about 4 to 8 sessions. Students who might have longer-term issues that might require more specialized care, those are concerns that we might refer students into the community for, and in those cases, the student health insurance would help pay the deductible for those services.
Can you get waived from the insurance for the first semester if you have other insurance coverage? It depends on the insurance carrier and the type of insurance. For an example, Kaiser Permanente, it does not participate in network with Duke Health. So Kaiser will get an automatic denial. So it just depends on the type of insurance company. I normally say the big four, which is Blue Cross Blue Shield, Cigna, Aetna, and United Healthcare, normally have coverages that participate in network with Duke Health. But like I said, it also depends on the type of policy that you have. PPOs are insurance plans that travel. PPO is basically short or abbreviation for preferred provider options. There's another type of a plan called an HMO. HMOs normally don't have any coverage outside of their home state unless it's for an emergency situation, and it's normally a one-time deal only. But if you're under Blue Cross Blue Shield and you're under an HMO plan from a different state, we'll just say Oregon, then you're able to access what they call a guest membership or home away from home, to where you can have the same coverage here in North Carolina if you're at Duke that you would have in Oregon, which is something that they grant for actual students. And that's how you can get around the HMO process of it. So it just depends on the type of plan and who the insurance carrier is. Normally with third-party insurance carriers, they may be underwritten by United Healthcare or Cigna, Humana, somebody like that. Those ones are a little bit tricky. We have to kind of call the validate with the insurance carrier to make sure that they participate in network with Duke Health. But normally with the big four, like I said, Blue Cross, Blue Shield, Aetna, Cigna, United Healthcare, they normally have a variety of different packages that are actually participating with Duke Health, where it doesn't really cause much of an issue.
I would highly encourage you to look at what the deductibles are for the mental health coverage. Sometimes students will have adequate coverage for the medical side of their insurance, but with the mental health coverage, they may have an incredibly high deductible. And what that means is that the student is covered well if they end up breaking a leg and they need services outside of student health, where they have to go to see an orthopedic. But if the student needs longer term mental health care and they have a $3,000 deductible and aren't able to meet that, the student in essence doesn't really have mental health care then. And so in order to have that insurance waived, you may be able to get it waived in terms of what it looks like in terms of comparing the medical insurance to the medical insurance, but it can result in the student going without the mental health care that they need. So like I said, I just encourage you to really look at the plans very carefully and to see what kind of coverage it's going to provide your student.
Another thing you want to think about too is cheaper isn't always better. We have students that, for budget reasons, will try to waive out of Duke Student Blue using third party or using Affordable Care Act plans, which is okay. The only thing is, number one, is it going to meet the Duke waiver requirements? And number two, as Dr. Oakley said, what are the deductibles? So it may be cheaper per month in essence and could save you money, but you cannot predict an emergency when it happens. So we have situations where a student may run into a medical procedure that they need to get done, but they have a $10,000 deductible, which isn't feasible for their budget, because that deductible has to be satisfied before the insurance will kick in and pay their portion of the insurance claim. My insurance requirement is waived, but then expires during my first semester at Duke. What happens then when is the enrollment period for the student insurance? Okay, so to answer that question, if you waive the Duke Student Blue Plan when you're first coming to the university but turn 26, so you're going to lose mom and dad's coverage, or a loved one gets laid off from work that you're under the insurance policy, or you have a qualifying life event, which means, you know, childbirth or any of those situations, students can always enroll into the Duke Student Blue Plan, and basically it'll be a prorated amount of the time that's left in the school benefit year. The school benefit year runs from August 1st through July 31st of the very next year. With that being said, if you lose coverage in November, then of course you can start the insurance policy either in November the 1st or December the 1st, and that will determine how much of a prorated amount you would get because it's broken down per month. Now, when you pay for the Duke Student Blue insurance, they bill it for the whole school benefit year. But like I said, there are certain situations, where students will lose coverage for various reasons and need to enroll, and then whatever time is left is how they're billed. And it's also billed to the bursar account. So however the bursar payments are being paid is how you satisfy the insurance payment. How can I learn the specific type of treatment, medication, or shot is available in Durham?
What's the question?
How can I learn?
How can I learn if a specific type of treatment, medication, or shot is available in Durham? If you are referring to the vaccines that are required for entrance to Duke, then we will have all of those available to you. We're having an immunization event August 14th, 15th, and 16th at the Penn Pavilion, which is a facility here on campus. And that'll be from 9 in the morning till 4 at night. You should be getting more information about this from your specific programs, but you will not need appointments, and you can just come to this event and get any necessary vaccines or TB testing that you need. As far as the medications and treatments, that would require you coming in and having an appointment with us at Student Health and seeing one of our providers. And that is the type of thing Calvin was saying is covered under your health fee. You can come and see one of our medical providers under your health fee. Now, some of the medications and some of the extra treatments may cost, and that would be when your health insurance would kick in. Calvin, you got to read for us.
I was trying to see. I didn't know. I'm sorry. How does the health insurance work for spouses? Is the medical coverage the same? How much does it cost? Okay. With that being said, it does work the same for the spouse. The medical coverage is not the same. It costs more for the spouse. I believe it's like $6,500 for the school benefit year for the spouse compared to $3,535 or $3,535 for the student. The reason why it costs more for the spouse is because the student has access to Duke Student Health to where the spouse doesn't have access because they're not a student. So they would have to seek care like a Duke primary care or get their own primary provider outside of Duke. So of course the spouse or the dependent would use more of the benefit dollars than the actual student would, because the student has access to the student health center to where they don't have to pay a copay to meet with a doctor or nurse, compared to the spouse or the dependent would have to pay the copay, and then they would bill the insurance for every single thing that they got done. So an example, in a nutshell, I know it's extreme, but if their spouse goes to the primary care physician because they're sick and they're given penicillin, there's going to be a charge for the actual copay, the doctor visit, and for the penicillin medication when they go to the pharmacy. Unless it's administered there, then they would get a charge for it being billed in the facility. If they're given aspirins, things like that inside of the doctor's office, they're billed for every single thing that they're getting, compared to a student at the Student Wellness Center. They're only being billed for labs, x-rays, or for vaccines. If we give them an aspirin inside of Duke Student Wellness, there's no charge for that. It's part of their health fee. Like I said, with like braces, if they fall and hurt themselves, if they had needed crutches, All that's covered under the health fee, to where a spouse or dependent would have to pay for the materials or the DME, durable medical equipment, if they go to see a primary care physician outside. So the spouse and dependents use more of the insurance dollars than the actual student, and that's why the cost for the premium is higher for them. What services does Duke Reach provide?
Duke Reach is the university case management provider, and so what they do is they really provide a safety net for students. Any student who, a faculty member, a staff member, another student, or a parent who might be worried about another student can contact Duke Reach, and one of their staff members will reach out and contact the student or identify someone else who's connected to the student, just to reach out and to check in to see if the student's doing okay and find out what resources might be helpful. The folks in Duke Reach might also reach out to faculty members or staff members who have frequent contact with the student, just to see if they're going to classes or if they've been seen in the residence hall, just to see has there been contact made with the student, because sometimes students aren't seen every day or regularly on campus, and so we can find out who's had contact and who might be in the best situation to be able to reach out and have a conversation with the student. We work very closely with them in CAPS. It's a very important relationship for us, because at CAPS, the work that we do is confidential. We cannot let anybody know that anybody that we're seeing at CAPS is actually coming to CAPS unless we have a release of information. Duke Reach services are they are non-confidential, except as protected by FERPA rights. And so they have the ability that if someone reaches out to Duke Reach to say, I'm worried about a student, they can actually do outreach communication to students and to faculty and others to see if a student is okay. And so it really serves to, as I was saying, to create a safety net. They can also help students find resources in the community. So if they need help with finding housing resources, mental health resources, or other types of things, they can help them make the necessary connections. They can bring families into the picture in case the student hasn't been letting families know what's been going on with them. They can work with the student to bring in a greater group of people who can help support them while they're having difficulty.
How can I receive a shot and get lab work done?
If you need vaccines and lab work for immunization compliance, meaning you need the required vaccines for admission, you can come to the immunization event that I was talking about a few minutes ago. That's again August 14th, 15th, and 16th at the Penn Pavilion. If you would like some vaccines or lab work that is not related to compliance, immunization compliance, you can schedule an appointment with our immunization nurse. And I can give you the phone number, but it's also on our website. So you can go to the Duke Student Health website. The phone number to set up an appointment with our immunization nurse is 919-681-93. I'm drawing a complete blank.
Is it 681 well?
No, I will get back to you before this is over with.
That's
I'm
the clinical
drawing
nurses,
a
I'm sorry.
complete blank. I write it every day. 681-9300, option 1. My apologies. Again, it's on the Duke Student Health website as well. You can find the phone number there to set up an appointment with us.
And I'll just put in a plug for the event that they hold. Is it T-Spot?
Yes.
T-Spot event,
That it's
yes.
actually, it may not sound fun because you're going to get shots, but actually students have described the event as actually very fun because
Good.
there's a lot of interactive activities, there's food, there's games, and so they try to make it as fun as possible, and it's a great chance to be able to meet other students who are waiting in line as well.
Right. And so for the international students, if you do require TB testing, we do require that it be done in the United States. So this is an opportunity for you just to have that done when you arrive on campus. And again, it is, we do try to make it a little bit of fun.
Mhm.
It's kind of a social scene as well as a vaccination event. So we do encourage you to participate in that.
And I'll be there, and people think I'm cool.
As you are.
Does the student health cover a psychologist? What about a psychiatrist? And what happens if I'm already receiving medication in my home country?
Yes, your student health fee covers the services of mental health, which can be found in counseling and psychological services. If you are already on a medication and you are stable on that medication, you have a couple of different options. You can go to student health and have that medication prescribed if you want to. You can have that transferred to the pharmacy. We have a pharmacy in our student wellness building. You have another option if you would like to start therapy. You can come to counseling and psychological services and get started with what we call an access visit, where you just drop in between the hours of 9 to 4, Monday through Friday. At the time you want to get started, you will meet with one of our access counselors, and they will talk with you about what your mental health concerns are and help you determine the best course of action. And that might be starting services with us at CAPS. It might be referring you to services that are on the campus in another office, or it might be referring you to services in the community. We'll just try to help you make the best decisions about your care. And then we also have a referral coordinator. If those services are in the community, our referral coordinator will actually help you make those appointments and make sure that we're addressing any barriers to you getting to those appointments as well. So we try to be that one-stop shop to help you figure out what the next best step is for you. So I encourage you just to come in and let us help you figure that out.
Sorry, I missed the earlier. What is the difference between the health fee and the student insurance fee? The health fee is a fee that's charged to all Duke students. If you're living on campus or around the Durham area, that fee is charged, which gives you access to the Duke Student Health Center to meet with our providers and our nurses to discuss major or minor and urgent medical situations. And of course, that also grants you access to our nutritionists who are on site, Tony and Franca. That gives you access to Duke Well and Duke Reach as part of the health fee. The insurance is basically insurance coverage for minor, urgent, and major medical situations, specialty visits, dermatology, GI, cardiology. If you need to have any kind of emergency procedures done, meaning EMS transportation, surgeries, cancer screenings, that's all part of your actual insurance policy. What clinics are available for graduate students who live off campus?
So the health clinic, the Student Health Center is available to you as well during the school hours. The clinics, student health hours are 8 to 5. Is that CAPS hours as well?
Yeah.
We do stay open on Tuesdays. Student Health stays open on Tuesdays until 7 o'clock.
And so does CAPS.
Okay, because we do recognize that you guys are busy during the day, so we're hoping that on Tuesdays from the extra 2 hours will grant you some access. There are other like urgent cares in Durham that are Duke related, but they are not covered under your student health fee. You can go to those urgent cares as needed and after hours, but that is one of the things when your student health insurance will kick in. They would not be covered under your student health fee.
Serious medical procedures conducted at the Duke Hospital on West Campus. Well, Duke Health or Duke South, the hospital, of course, it's a hospital, so they can conduct serious medical procedures there, surgeries, life-threatening illnesses. All that stuff can be handled at the Duke Hospital, which is right off of West Campus. If you are at the chapel area and walk back towards the back building, that's the back door to Duke South. So you're actually have access to the hospital on campus. Like you said, right off of West Campus is the entrance to Duke South. But we're connected right to the hospital. So any medical procedures that would need to be done, whether it be minor, urgent, or major, can all be done there. In other words, if you can't sit, walk, or stand without extreme pain, that's the first place you're going to want to go.
And some minor procedures can be done in our clinic setting, very minor things, but our providers will know when you need to be referred to an outside provider. And we have a referral team on staff that will help set you up with the necessary provider or necessary specialist and help you with those appointments and get you set up with those.
What is the immunization deadline?
We ask that all the records be submitted by June 15th. This gives our office time to process all of the records that we are receiving. The actual state deadline, the state of North Carolina gives you 30 days from the first day of class to have all of your immunizations completed. If you don't receive all your immunizations or TB testing by that date, we do have the ability to pull you from class and deactivate your Duke card. So really the earliest you can submit your records to us and let us process them and begin the process of letting you know what you need, the better off you are. If you can get your records to us early, and then you will know if you come to that immunization event, we'll be able to let you know at that time what you will need to become compliant. The first 30 days of class goes by very quickly. Our immunization appointments fill up very quickly, so the sooner you can get it done over the summer, the better off you will be.
Student health insurance coverage, our children as well. Yes, you can enroll your dependents onto your student health insurance. Like I said, they would have the same coverages that you would have, but the cost is significantly higher to add them on because they'll use more of the insurance dollars than what you would, because they won't have the access to the student health center or student wellness building. So they would have to go through Duke Primary Care, Duke Pediatrics, in order to have their medical needs service. So everything that they're going to get billed for is run through the insurance compared to the student who has access to the student wellness building, which would eliminate some of that cost to the insurance plan. Will my financial aid cover the cost of the health fee and the student insurance? That's a conversation that has to be had between the student and their financial aid officer or financial aid office. We don't get into the matters of financial aid with the student because we don't know what financial aid is going to pay for and what they won't. We've had situations in the past where financial aid was able to allocate more funds to the student or to at-need students to help cover medical costs. Cover medical insurance if they didn't have insurance coverage or if their insurance coverage wasn't adequate for Duke Health, meaning that if they had their if they're under like Medicaid, for an example, Medicaid from the state of Maryland. Medicaid from the state of Maryland, of course, won't work in the state of North Carolina because it doesn't have any benefits outside of the state of Maryland, where the student would need coverage but are at need for financial aid. Financial aid may be able to allocate more funds to allow for the insurance policy to be paid for through financial aid, but that's a conversation that has to be had between financial aid and the actual student. Like I said, we don't get involved with that situation or with that conversation. That's between the student and financial aid office or financial aid officer. How often do graduate students use the clinics on average? I deal with a lot of grad students. That's just me. Not only do I do insurance, but when our referral coordinator is away, during orientations or, if she's off site somewhere, I'm her backup. And the majority of students that I normally see are grad students. It's kind of rare for me to get an undergrad student. So the grad students, I'm guessing, would use the clinics as much as the undergrads would. It's just that the grad students, sometimes their schedule is a lot more flexible than the undergrad students are. So they tend to be around a little bit more often. So it just more or less depends on whatever the healthcare need is at the time. During like cold and flu season, I know flu season sometimes hits hard here because you're around students. One student gets sick. If you're in a classroom setting, multiple students can become ill because they're around a sick student, Lord forbid. But they're able to actually come into the student wellness building. So like I said, a lot of those students that I'm actually dealing with, just from my perspective, are grad students. So I don't deal with a lot of undergrads. They're more grad students than anything.
And we really encourage you to use the Student Health Center as your primary care provider while you're a Duke student. Consider us, because we have on staff, we have physicians, nurse practitioners, physician assistants, nursing staff. CAPS has a lot of availability, so you can consider us, and it is part of your student health fee. So we want you to utilize us as your primary care provider while you're on campus.
Yeah. We see graduate students at the same rate as they are present on campus.
I agree.
We've been seeing a rise. If you pick anything up and read it lately, you'll see that there's a real crisis in graduate student mental health right now, and showing that the rates of mental health are higher in graduate students than in the population at large. And so we have been really trying to lean in and help graduate students by offering specific types of groups for graduate students. And part of, the impetus for being open late in student health and in CAPS was to reach graduate and professional students. So we're trying to be particularly responsive to graduate student needs.
What types of illnesses are common in Durham? Just from what I can actually see, cold and flu, strep throat are the three that I see the most of, because it's real easy to pick up the cold or flu. You're around someone who, we'll just say, for instance, sneezes and doesn't cover up, or if they cough and don't hold their hand over their face, or pink eye is another one, where someone may get pink eye and touch their face and then touch something on the surface and you touch the same thing. It's real easy to pick up that kind of stuff, which is common. It's just like if you were in your own household, around your family members, one person gets sick and before you know it, the whole house ends up becoming sick. But those are the most common illnesses. I would probably say is cold, flu, sinus, strep throat, pink eye. Those are the cases that I actually see the most. I can't speak for Ellen, but just from my point of view, those are the four most common things that I see.
I want to mention too that we have a service available that you can call and actually talk to one of our triage nurses if you have questions about whether you need to be seen in student health, or if you really just want some kind of home care advice. Triage nurses are available to you for that. They're staffed during the day, and then when we are closed at 5 o'clock, our phones roll over to another line that's available to you. Then you can speak to a triage nurse who can, again, kind of guide you as to whether they think you need to come in for an appointment to be seen, or if they can just guide you with some home health care, which is oftentimes what you need just to get over some of the minor illnesses that you may acquire.
Best thing I can actually say about that is make sure you wash your hands frequently and use hand sanitizer. Hand sanitizer be your best friend. What advice do each of you have for students new to Duke and Durham?
It's a great question.
I would just say to embrace your experience here. There's a lot to do in Durham. It's growing every day. There's great restaurants. There's some great museums downtown. I would just take advantage of all the opportunities you have just here on campus. It's a fun place to work because of so many things that are available to us as faculty. So keep your eyes open and just, take advantage of some new experiences.
I would say that there is so much to do. There are so many opportunities because it's such a great institution. Because the number one issue that we see at CAPS is stress and anxiety, that I encourage students to pace themselves, that get involved in a few things, and to recognize that the students who come to Duke are the best and the brightest, and to recognize that your striving for perfection is not really all that helpful, and that doing extremely well is going to be better than most in the world. And so I know that's it's a hard advice to take, but I really mean it when I say that, because so many students talk about just feeling really burned out and exhausted. And so we want students to try to get balance and to take care of their well-being while they're here, and to focus as much on excellence in their education as much as they focus on being well. And so I want to reiterate, use the services in our student wellness building and on campus that have to do with being well. Do Well has a lot of resources about prevention. And so we've talked a lot today about what do you do when you're not well mentally, emotionally, and physically, but really pay attention to what can you do proactively. Calvin talked about washing your hands and using antibacterial. You can do that physically, but what do you need to do to take care of yourself emotionally? Does that mean that you meditate? Do you need to exercise? Do you need to eat well? And what can you do when you first get to campus to take care of yourself and to set some of those routines up, so that when you start getting stressed, you already have those routines set up so that you can already have those in place, so that you can already be healthy, so that it's easier to fall back on those as opposed to trying to start those routines at a time when you're stressed.
I agree with both ladies. There are a lot of things to do in Durham and around Duke. There are a lot of great restaurants. There's a lot of healthy choices, and there's a lot of not so healthy choices. But you do have to be prepared mentally to come here, because you are the best and brightest students. Many have tried to get in here. Few were successful. If you're here, it's because you are the best and brightest of the students. But there are things in place for you to be successful here, and also to relieve stress. There's CAPS. You have Do Well. There's classes you can take, like yoga and singing, to play with singing bowls. We have the Oasis room, where you can go in and relax. There's massage chairs. There's a variety of different things in place to help the students make it through. You just have to take advantage of it. We're here to help you. We didn't bring you here for you to fail, because nobody benefits by you failing. But there are parameters in place for you to be successful. You just have to use them. I'm on questions, so if you have any final remarks you'd like to share, and the incoming students, please go ahead.
I'm going to throw in one thing about immunizations. It can be a confusing process, and again, it's something we're tied to by law. I encourage you to go to the student health website. If you go on the main website, there's a left-hand tab that says immunization compliance. If you click on that, we've laid out the steps very simply on what needs to be done, starting with the first thing, which is an online questionnaire. If you follow those steps, and then at the very bottom of that page, there's some frequently asked questions. If you click on that link, hopefully between those two resources, you will be able to have your questions answered. If not, feel free to call the number on the screen and talk to one of the triage nurses or to myself, and we will help you guide through this process, because it can be very confusing. So don't let it overwhelm you. We're here to help you with that.
I would say welcome to Duke. Congratulations. We're excited to have you come and join us. I would encourage you, when you get here, come and see us. Come and visit us. You don't even have to come into any of our services if you don't want right away, but come and find out where we are, so that when you do need us, it's easy. And you already know where we're located. It's easy to find us. But check out our, if you don't need student health or you don't need CAPS right away, Check out the wellness services that Do Well offers. Check out the trails that we have on campus. Check out Duke Gardens. Check out the places that connect you to your own well-being and get those routines started.
I'm a little bit biased because before I started working here, I was actually a Duke fan. So to me, I just would like to say welcome to the family. Glad that you're here. Like we said before, there are parameters in place to actually help you succeed while you're actually here. This is going to be a fun time for you. You're going to have moments where they're stressful. You're going to have moments where this is like the greatest decisions you've ever made. But just take advantage of it. Enjoy your time that you're actually here. Study hard, have fun, enjoy it, and you'll be perfectly fine.
I don't think we mentioned where we were located. So the Wellness Building is a tall glass building, and we're on the corner of Tower View and Union Drive. We are next to, very close to the Bryan Center and the Duke Chapel, and those are two main key locations that you will recognize quickly. And if you're close to the Duke Chapel and the Bryan Center, you're close to us. The Student Health Center is on the second floor. CAPS is on the third floor, and Duke Well is on the first floor. We also have a dentist here on the first floor that is available to the students as well.
The dental office is called Campus Smiles Dental. Like Ellen said, they're located on the first floor, connected to Duke Well and Duke Reach. Also, on the third floor, we have PT for physical therapy in the event that you would need physical therapy. But our address, we're located at 305 Tower View Drive. Of course, that's here in Durham, right attached to campus, diagonal from the Card Wilson parking lot where Cameron Indoor Stadium is, and also where the Card Wilson Gym is, and down a little bit from the football field. So we're not hard to find. Just make sure when you tour campus that you actually come by and say hello. We like to meet people, wave and laugh and have a good time. We're not bad guys, but we look forward to seeing you when you come.